Good afternoon, everybody. My name is Jose Corona,
And I'm Kelsey Aguirre.
and today we'll be doing our topic on aloe vera and using it as an adjunct to oral health care. And today we'll be discussing everything that has to do with aloe vera, all its contents, and how it relates. So people are constantly looking for a healthy option. They're pushing more towards a natural supplements, homeopathic treatment, all that stuff. And as providers, we should be looking at improving our patients' overall health care and trying to meet their request for healthier options while minimizing any negative side effects. So aloe vera is getting a lot of attention as a natural alternative to many different conditions and treatments. This plant has been a successful adjunct due to its anti-inflammatory, antioxidant, antimicrobial, and wound healing properties. When dental procedures are performed, whether it's an extraction, NSPT, and bone grafting, the tissues get manipulated and thus run a risk for infection, and that's why it's an important adjunct because of all these properties.
Along with these other things, aloe vera also contains properties that help prevent the body's innate immune system from attacking its own cells. It also has antimicrobial properties that aid in inhibiting protein synthesis and antioxidant properties that's main role is to rid free radicals, as well as working with anti-inflammatory properties to promote and speed up wound healing. This is very important in our patients that have issues with wound healing, such as our diabetic patients or immunocompromised patients. It can also decrease or eliminate the amount of bacteria, speeding up the healing process of the periodontal pocket by way of long junctional epithelium, and it prevents the innate immune system from causing any negative interference that can actually delay the wound healing.
Okay, so aloe vera, after looking at many studies, was found to contain a large amount of things. These include saponins, glycosides, and sugars, which all act as antiseptic properties. It also contains a lot of vitamins such as vitamin A, C, E, B1, B2, B3, B6, folic acid, and even contains 7 of the 8 essential amino acids that we need in our body. It contains a substance called the luteol, which provides painkiller properties that mimic aspirin. And the aloe vera gel has enzymes in it and has acid phosphate, amylase, lipase, and also has a salicylic acid, which contribute to the analgesic effects.
So it also has antibacterial properties. Acemanin agent is what indirectly activates phagocytosis, which is found in that antibacterial portion. And there were a lot of studies. One study showed they found aloe vera more effective than 2 other toothpastes in controlling S. mutans, lactobacillus, Candida albicans, S. mitans, P. intermedia, and it's also good against S. mitans despite absence of additional fluoride, which is great for our purposes. It's shown to reduce the pain and wound size of aphthous ulcers, and another study showed herbal mouthwash just as good as anti-plaque properties as 12% chlorhexidine. It's known to be a cavity disinfectant, which minimizes secondary caries, renders long-term success, where excavation alone cannot eliminate all cariogenic bacteria. It is an antibiofilm activity that decreases bacterial biomass. And daily consumption foods to reduce amount of lactobacillus streptococcus mutans in saliva.
So as we discussed earlier, it also has anti-inflammatory properties which benefit us as hygienists when we're performing an SPT on patients. So it inhibits histamines and leukotrienes that are released by mast cells. It helps stimulate macrophages to release nitric acid and cytokines. It's also been shown to inhibit cyclooxygenase pathway, which reduces prostaglandin 2, which reduces pain, and we've also seen prostaglandins be associated with the breakdown in periodontal disease, so the breakdown of tissues. It also reduces leukotrienes and tumor necrosis factor A, which are inflammatory mediators, so it blocks the inflammatory process, and it also helps stop the breakdown of periodontal tissues, as those are also cytokines that are also found in periodontal disease. And it's also been shown to have great reduction and great benefits in plaque-induced gingivitis by, again, reducing the inflammation.
Lastly, it works as an antioxidant and also promotes wound healing. It contains vitamins that contribute to the ridding damaging oxidant enzymes at infection site, and gel extract to help increase plasma total antioxidant capacity. For wound healing, it increases T cells by about 50%, activity and macrophages amount. Teeth sensitivity, it does not contain abrasives. And denture adhesive, it's a prototype Asamine, was formulated as an adhesive, stimulates fibroblast proliferations, collagen synthesis, and angiogenesis, and post-extraction socket healing promotion, which is another one of the things with alveolar osteitis. It's important to help with that.
So one of the great things about this product, so to recommend to patients seeking a more natural homeopathic, they don't like the medicinal way because of all the side effects. So the good thing about this is it doesn't really have many side effects. There's still not a lot of research on it, so as far as long term, but some of the side effects we did find or contraindications are if you have any allergies to the Liliaceae family, because aloe vera is part of that family. As far as pregnancy goes, there are studies that suggest that it stimulates a uterine contraction, so therefore it's best to avoid recommending to pregnant patients. It's also, one study found that it causes GI distress in nursing infant. Therefore, if a patient is breastfeeding, we also might want to be cautious with that. Topical application can cause redness, burning, and stinging sensation with those patients who suffer from an anthraquinone allergies. And also, as far as systemic effects, could include abdominal cramping, diarrhea, which leads to electrolyte imbalances, red urine, and constipation. But again, that's very rare, and very few studies have found those kind of side effects. But it's still being researched.
So for further study suggestions, we already know that there's a lot of studies out there on aloe vera, not only in the dental field but in other aspects. But for future, it would be great to see long-term study with a larger sample to gather better understanding of the long-term effects. Whether is it working long-term? Is it just happening for a little while? And then we want to know more information on long-term healing properties. Releasing patterns of local drug delivery system required, and its effectiveness depending on the delivery method.
So current literature and research has shown that aloe vera's contents and benefits as a homeopathic options are great. This plant offers a more natural, has natural properties, all of which we talked about, all of which are beneficial in preventing and also taking the therapeutical option when it comes to the oral cavity. Aloe vera has also shown in studies to contribute to anti-cavity properties and also contributes to wound healing. Because of these findings supporting aloe vera's many benefits, it is suggested to be an effective adjunct to non-surgical scaling and root planing when treating periodontitis, or, as we saw, also expand its scope into other restorative treatments such as cavities, like prepping for a cavity. It helps reduce the cavity bacteria. It's also easily accessible. It's an easily accessible plant that is cost effective. It has a lot of peer-reviewed clinical applications, and a lot of products are starting to come up with it. It requires minimal equipment to utilize, and it's a great natural option for, again, the increase in patients who are now seeking natural homeopathic options, and they're trying to stay away from any local drugs.
So that is our presentation on aloe vera, and we look forward to seeing you.
And seeing you guys try to utilize it and see how it works.